Today we will be talking to Dr. Philip Griffin and Dr. Robert Keefer from Now Hear This on an advanced hearing and fitting system. Welcome, Dr. Griffin and Dr. Keefer.
Thank you for having us.
We are so glad to have you here today. This is very exciting information to have and definitely a topic that folks should know more about. So you brought with you today some of the top 10 things that people should know about hearing and hearing aids and hearing loss, and they probably don't. And I thought we would share a few of those, and if you want to put some input in, we'd be glad for you to do that. You said that in a national survey, 87% of patients said they have purchased a hearing aid from an audiologist at the place that they bought it from, but they didn't have an audiologist. Why is that?
Yeah, right now in the hearing care space, people aren't really sure who they're going to see when it comes to their hearing care. You have a few different professionals that are involved in caring for hearing, such as ear, nose, and throat physicians. Even family doctors answer questions about hearing. Audiologists and hearing aid dealers, and a lot of times patients simply don't know who they're talking to.
They just assume.
Yeah.
It must be an audiologist.
Exactly.
And everyone wears a white coat, so.
Right.
Another thing was only 20% of hearing aid users report being very satisfied with their hearing aids. That's a sad statistic.
It really kind of is. It's an unfortunate statistic, and it's one that we're trying to change. Unfortunately, hearing aids, for a variety of reasons, aren't very satisfying to patients at this point, but the main reason is because usually they're not fitted properly. People who do have their hearing aids fitted properly report much greater satisfaction. And
we're going to be hearing more about that.
Absolutely, absolutely.
And the last one I've been hearing more and more about from the national news is that recent studies have shown that hearing loss is linked to a much higher risk of dementia, Alzheimer's, depression, falls, and less earning potential. And those are all huge issues for seniors. The falls, the Alzheimer's, the depression, I mean, all of that leads to a slippery slope.
Absolutely. The research that's coming out is very interesting, and it's perking up a lot of ears in different medical disciplines, and audiology is one of those, but also, as you mentioned, falls, which are becoming a major public health problem in America right now. And all these linkages are starting to become clearer and clearer, and we're seeing how the brain and the body needs stimulation, exercise, hearing, cognition, all of those things to stay healthy in more ways than just one.
That's right. Very good. Yes.
And if I can amplify on that just a little bit, it was a recent study that followed over 600 patients and found that those who were hearing impaired had up to 5 times the risk of early dementia or Alzheimer's or other these adverse health effects. So it was a very well-controlled study, actually sponsored and funded by the National Institutes of Health.
Oh, wow.
Yeah.
And you know, they just say the word Alzheimer's or dementia, that strikes fear in the hearts of so many people.
Yeah.
Absolutely.
Definitely. So if there's anything we can do to help prevent that, that would be definitely something that folks would be interested in, I would think. Okay, so is it really necessary for patients and individuals to go to medical doctors for their hearing loss?
It's interesting, you know, when you look at hearing loss, out of all the hearing loss that's out there, only about 10% of it is due to a medical problem, such as a tumor or an infection or some sort of growth in the ear canal. Only 10%. So 90% of people actually just have plain what we call sensory neural hearing loss, which doesn't really require the intervention of a medical physician. So the answer to that is initially no. Most people can go see an audiologist first, and if there is a medical problem, audiologists are able to appropriately refer those folks. In fact, the VA system and the VA hospital has changed the way they do it. In the past, all veterans used to see ear, nose, and throat physicians first for their hearing loss and then go to audiology. But when they started looking at that and looking at the costs of that, the time it takes to do that, they said this doesn't make any sense. For those 90% of people, they really just need audiology. So they've actually switched that. So now all veterans see audiologists first before ear, nose, and throat doctors, and the trend is starting to become that way out in the general public as well.
So for the lay people out there, what's the difference between an audiologist and a medical doctor?
And a medical doctor, right. A medical doctor or a physician is someone who specializes in more physical problems of the ear that may cause hearing loss.
Mm-hmm.
So these would be things that require medication or surgery
Okay.
to fix, such as infections, tumors, growths, diseases in other parts of the body that affect the ears. So this would be true medical care. Audiologists don't go to medical school per se, and we don't learn how to do surgery or prescribe.
Okay.
We focus all of our attention solely on the sense of hearing,
Okay.
and the inner ear as an organ, and how we can rehabilitate hearing loss when traditional surgery and medication has no answer.
Okay. Well,
Yeah.
that's a very simplistic way of describing it. I think that helps people to understand. Thank you.
Mm-hmm.
So what's involved in a hearing test and what does it show? I know my children have had those at the doctor's office, but I always wondered.
Yeah, you know, what we do is we basically graph out and find out the softest sound
Mm-hmm.
that people can hear in different ranges, from bass to middle pitches to high pitches.
Okay.
So if we can find out what's the softest sound that someone can hear, then we can really tell, based on that, what other things they can hear as well.
Interesting.
Yeah, so everyone is supposed to hear sounds that have a certain amount of softness, all the way down to what we call 0 decibels, which is kind of like 20/20 eyesight.
Okay. That's a good way.
So we measure that and we find out, okay, does this person have 20/20 hearing?
Right.
And if they do, that's great. They can hear everything they need to. If they don't, then we classify that as hearing loss.
Okay. Interesting. So how do you decide the style of hearing aid if you determine that someone has a hearing loss?
Yeah. Choosing the right hearing device or hearing aid for someone is actually pretty complicated, and there's a couple factors that go into it. The first thing is the hearing test.
Okay.
So the hearing test is what we look at in main terms of how much power we need in a hearing aid to amplify correctly for the hearing loss. So we look at that hearing test to get a prescription that we need to match, so to speak. But we also have to look at other factors too, like how big of a hearing device is the person willing to wear, or how invisible would they like the hearing aid to be?
There's a big stigma. People still, to this day, especially women, they don't want to have something that people can see.
You're absolutely right. And believe it or not, sometimes men are even more vulnerable to that because we have no hair
To cover it.
to cover
There
up
you
any
go.
hearing aids. So I have had plenty of male patients who say, boy, I'd really like to hear better, but I just don't want people to see it, and I'm bald, and if I wear it, people will see it.
Now, I hear it all the time in caregiver support groups that I facilitate. If she would only wear a hearing aid, gosh, that would make a huge difference in her ability to socialize and interact with others.
Absolutely, absolutely.
Yes.
I might add too, Philip mentioned the invisible in-the-ear hearing aids. I'm not an audiologist myself,
Sure.
but I've talked enough with Philip to know that those kinds of hearing aids can oftentimes be perfect for a patient because it actually can improve the sound quality as well.
Perfect. Well, we're going to take a short break. I'm here today with Dr. Griffin and Dr. Keefer from Now Hear This, talking about hearing loss in older adults, and we will be right back.